I want you to focus in on avoiding repetition. A really common mistake, and something that I think as well, if you haven't gotten onto it already, this is the time to start to focus in on this. Try not to repeat any information that's already provided in the STEM. Avoid mentioning things like smoking cessation in the management options if the patient's smoking status hasn't actually been indicated. This is a way of showing that you have put your contextual knowledge of management of these kinds of patients to the patient sitting in front of you. If the patient's not mentioned to be a smoker, it's not something you would necessarily presume, and they're trying to give you the information relevant to the case in the STEM. So all the information you need to make your answers should be there. It's a really important thing to try and remember. Now, of course, for history taking, for questions around a patient's symptoms, focus on new or relevant details that may specifically answer the question being asked. Again, a common thing. Make sure you're answering the question being asked. And make sure as well, as part of that diversifying your answers, try not to use the same response for multiple questions in the same case. If you're finding that that is something you have fallen into, look where that answer might be most appropriate and use that opportunity then to redirect one of those answers towards a different area. Now, if you're struggling to actually fill in and find those answers, there are those fallbacks to kind of lean back on so that you can hopefully regain as many marks. And really, a lot of it comes back to reading the qualifier of the question. Now, for diagnosis, I want you to really focus in on what is the potential acute diagnosis, what is the subacute diagnosis, what is the chronic diagnosis. Usually, if you try and apply that kind of framework, you're going to be able to tease out usually 3 responses that may be applicable to that question. On the acute side, don't forget your DRS A, B, C, D, E. Think through each, for the presentation, each of those different aspects and try and see if that will actually tease out a management option for you. If you have a surgical patient or a patient that's potentially going to need surgery, a free easy mark is don't forget to fast the patient. Make them nil by mouth so that you have the best chance possible of securing a mark there. And of course, the old thing of don't ever forget the glucose. A really, really important thing is to monitor, to check glucose or supplement glucose as required. For your chronic management options, some fallbacks will be, if we're looking with pharmacological, don't forget oxygen is technically a drug. It is a thing that is administered and so falls under that pharmacological management. Of course, the medication, in previous years, you've had to know dosing and dosing regimes, no longer applicable. And so doses are not specifically required unless they are specifically requested. The key things for dosing you're going to need to know will be things like your adrenaline, your 0.5 mics, the things that you need to know in an emergency. So focus in on those kinds of things. Try not to get too bogged up in all the other individual doses for every medication. There's a change and a reflection that it's clinicians marking this. They appreciate that you're going to be checking AMH, you're going to be checking ETG to confirm the doses you're using in real life are actually applicable. Don't forget your immunisations as well. Know what could be applicable to the case sitting in front of you, bearing in mind that that answer can and will change if it's an Aboriginal or Torres Strait Islander patient who have a separate immunisation schedule. And I get it. I get it. It's so frustrating having to memorise immunisation schedules because we don't do it in clinical practice day to day. It is something that we would look up at the time. It changes all the time. It's adapted to the information base, but it is something for the exam you are expected to know. And of course, for your management, particularly of those chronic conditions, always remember your care plans and your health assessments can be pivotal in securing a long-term management plan. So focusing in on those is going to be easy marks. Now, for your non-pharmacological management, this is an area that some people really struggle with. Use those frameworks. Use things like SNAPs, smoking, nutrition, alcohol, physical activity. Don't forget to throw in a physiotherapist for a dedicated exercise regime. Bearing in mind, anytime you're mentioning any of these kinds of things, specify why you're doing it as well. So physiotherapist for, occupational therapist for home modification or activity modifications, psychologist for CBT or DBT or any appropriate therapy, dietitian for meal planning, weight loss regime as applicable. And your condition-specific kind of support services, whether it's an online support group, whether it's a group that are known to be active in this space, things like Cancer Australia, make sure you're using those extra supports. And of course, for legal advice, patient always goes to lawyer, doctor goes to medical indemnity. Don't forget as well, housing and living assistance. Looking at those social determinants are really, really important in the exam, and so exploring what kind of assistance may be available in that spot. And of course, the RACGP Handybook. If you do not know this handbook, you are throwing away marks. I can tell you now, there's always a couple of questions in every single exam that rely heavily on even passing knowledge of the handy handbook on how to approach that question.